My name is Brock Polnaszek. I am a board-certified maternal fetal medicine physician for Froedtert and the Medical College of Wisconsin Health Network. So I'm originally from Wisconsin, so I completed most of my training at the University of Wisconsin School of Medicine and Public Health. That's where I completed my doctorate degree. Then I did my internship and residency at Washington University in St. Louis School of Medicine. And then I moved out to the East Coast, actually at Brown University, where I completed my fellowship in maternal fetal medicine, as well as a master's in public health there. I like to tell patients that I see all type of birthing patients. So that ranges from people who come to see me just for a preconception visit, where we talk about how to optimize your pregnancy and have the safest outcome for you and your baby, all the way to meeting families when they have unanticipated things happen, either at the ultrasound with their baby or even in terms of their medical complexity. And my whole role is to really meet them as a family and design a care plan to keep them safe. I have really taken a lot of time to gain all of the skill sets that I could offer as a high-risk obstetrician. Things that I'm particularly passionate about offering my patients are helping them navigate some tough situations, such as things like peri-viable conversations in terms of the pregnancy, things like cesarean hysterectomy, or even all the way to complex things on labor and delivery, like doing a breech abstraction of a twin or a triplet. And so really what I've tried to do is gain all the skill sets so that my patients have choice in what they do or do not want their labor and delivery experience to look like. Practice philosophy for me is always about the patient. So I think the first time I meet someone is often not in the situations that either of us would want to be meeting each other. And so the first thing I like to get to know is them as a family and as a unit and their support people. And then what are the things that they value? What are the things that are important to them? And then I try to design the care plan in the way that makes sense with those values and those missions. So my first thing is always to get to know what's important to them. I think being a high-risk obstetrician is the epitome of what it means to be a physician. It's like one of the reasons that I chose to go into this field. And that includes things like advocacy work that I'm working on, from policy and legislation, insurance coverage aspect, increasing parental leave, all the way to one of my biggest passions is research and really trying to look at improving the way we provide care to birthing people in our country. I also really like just the bread and butter things. I think it's a really sacred time in a family's life to interact with them, and I feel very honored to take care of them and get to know them as a family. My wife is also a physician here, and so our life is a little bit busy, but our free time is always spent outside, hiking or running or walking along the lake. We have an expanding family right now ourselves, as well as 2 French bulldogs that kind of rule the roost. So those are kind of the things that keep me occupied outside of work.